Hello guys, we are back again. On this video, we shall be discussing the anatomy of the ribs. Yes, if you are coming across my channel at the first time, don't forget to subscribe, like and comment and share our video. Yes. So without wasting much of our time, let's quickly look at what we have on today's video. So these are the ribs. Yes, we shall be discussing one of those bulky bony framework that constitute the skeleton of the thorax, right? Which is called the thoracic cage. Okay, the first thing we shall be looking on to is the introduction. You have to understand that the bony framework of the thorax, which is the thoracic cage, is formed by the ribs, mainly by the ribs, the sternum, and the thoracic vertebra. And you have to understand that the ribs are paired. There are 12 pairs on the both sides, right? So the skeleton of the thorax, which is mainly formed by the ribs, the 12 pairs of the ribs, protect and support the thoracic viscera, such as the lungs and the heart. So there are three bony structures that constitute the skeletal framework of the thorax, which is the thoracic cage. We have the ribs. The ribs mainly form its bulky skeleton, the ribs and its costal cartilage. We also have the sternum, which is the breastbone, and we also have the 12 thoracic vertebrae that is found on its posterior aspect of the thorax, right? Now, what is rib? What are ribs? Yes, ribs are flat, ribbon-like, elastic bony arch. They are flat, ribbon-like, elastic bony arch, which participate in formation of the skeletal framework of the thorax, which is the thoracic cage. Ribs, its anterior end extend anteriorly to be articulated on the lateral borders of the sternum, right? While its posterior end extend posteriorly to get articulated with the 12 thoracic vertebra. But you have to understand that the anterior end of the ribs, it is not all of them that made an articulation with the lateral borders of the sternum. Those ones that made an articulation with the lateral borders of the sternum are the true ribs. That is the classification of rib based on the relation to the sternum, right? Why there are some ones such as from 8 rib to 10 rib attaches or make an articulation through the higher cartilages. And the higher cartilages are those cartilages of the true ribs, right? Which is from 1st to 7th rib, right? Whereas the floating ribs, which is from 11th to 12th rib, does not make any articulation through its anterior end to any costal cartilage. The anterior ends are usually free. It is only the posterior end that made an articulation with the thoracic vertebrae, right? So that is how the ribs are being conceptualized. So the ribs are ribbon-like. They are ribbon-like elastic bony arch. They are flat ribbon-like elastic bony arch, which forms the main bulk of the skeletal framework of the thorax, right? I've discussed on how the anterior end and the posterior end articulate by forming the costal arch on the thoracic cage, right? So that is all about the introduction to the ribs. However, the ribs are 12 pairs, right? There are 12 pairs, right? On the both sides, the right and left aspect, there are 12 pairs on this manner. But sometimes we have extra rib or supranumerary rib, right? Such as the cervical rib or the lumbar ribs, which can exist is an anomaly. is a developmental anomaly, right? It is not a right way. Also, we can have a missing rib. We can have 11 pairs of rib on the both sides. The 12 ribs could be missing, right? So we can have 11 pairs of rib. So we could either have an extra rib or a missing rib. That is how the thing goes. Now, the next we shall be discussing is the arrangement. How are ribs arranged on the thoracic cage? It is essential that you know how ribs are arranged on the thoracic cage so that you know how ribs are fashioned. You know how these ribs are fashioned on the thoracic cage. The first thing you should understand is that the ribs are arranged one below each other. Like they are arranged one below each other. That is first, second, third, fourth. Continuous like that, the 12th rib, right? So they are arranged one below each other. And there is a gap between an adjacent rib. Between an adjacent rib, that is first rib and second rib. There's a gap here. And that gap is called the intercostal space. That is the first arrangement of the ribs on the thoracic cage or on the thorax. The second arrangement is that the length of the rib increases progressively from first to seventh rib and decreases gradually. The length of the ribs, right, increases progressively from first to seventh rib and also decreases gradually. Hence, the seventh rib is the longest rib we have on the thoracic cage. That is the second arrangement of the ribs, right? The third arrangement is that the transverse diameter of the ribs increases progressively from first to eighth rib. The transverse diameter of the ribs increases progressively from first to eighth rib. Hence, the eighth rib is the greatest lateral description on that area. So the eighth rib is the greatest lateral projection of the thoracic cage, right? Because the transverse diameter increases from first to eighth rib progressively. And that is to say that the eighth rib is the greatest lateral projection on the thoracic cage, right? We have the number 4 arrangement of the ribs on the thorax. You have to understand that the ribs are arranged obliquely. The ribs are arranged obliquely. Ribs are not arranged transversely or vertical or horizontal. They don't. They are arranged obliquely. That is to say that the anterior end of the ribs are usually lie on the lower level than its posterior end, right? That is why they are arranged obliquely. It is arranged on this manner. Let me just say it is arranged on this manner. These are the thoracic vertebra. The ribs are arranged on this manner. This manner. Why this is the sternum bone, right? So this is how they are arranged. It is arranged obliquely. That is to say that the anterior end of the ribs, here are the anterior end, lies on the lower level than the posterior end. That is to say that the posterior end is always lie on the upper level compared to the anterior end. That is the fourth arrangement of the ribs on the thorax. They are not arranged transverse or horizontal or vertical. They are arranged obliquely. Number 5 arrangement of the ribs on thorax is that the ribs are obliquely placed. That is to say that the obliquity of the ribs increases from first rib to ninth rib. The obliquity of the ribs increases from first to ninth rib. Hence, the ninth rib is the most obliquely placed rib. The ninth rib is the what? Most obliquely placed what? Rib. That is how they are being fashioned. Right? So those are how the ribs are arranged on the thorax. That is how the ribs are arranged on the thorax. Also, the width of the ribs gradually decreases from above downward. The width gradually decreases from above downward. So that is the sixth arrangement. So these are how the ribs are arranged. You have to understand again that I've said it previously that the anterior end of the ribs is attached to the lateral borders of the sternum. That is for two ribs. And posteriorly, to its posterior end is attached to the vertebra. Also, those ones are for the true ribs. The first ribs now, the anterior end of the first ribs are attached or articulated to the higher cartilages. The higher cartilages are the cartilage of the true ribs. And posteriorly, with its posterior end to the thoracic vertebra. Also, the floating ribs, which is from 11 to 12th rib, are floating rib, right? The anterior end is free. The anterior end is free. They don't have any articulation, either to the costal cartilage or either to the sternum. They don't, right? The anterior end is what? Is free. But the posterior end made an articulation with the what? With the thoracic vertebra. So that is how they are being fashioned on the thorax, constituting the bulky skeletal framework of the thoracic cage, right? So that is how that one goes. The next is the classification of the ribs. Classification. The ribs are classified into three. Number one is according to features. Number two is according to the relation to the sternum. Number three is according to articulation. Now, let's begin with the according to features. According to features, we have typical and atypical rib. Typical and atypical rib. And atypical rib. The typical rib is from third to ninth rib, while atypical rib is first, second, 10th, 11th, and 12th rib. So the atypical rib constitutes of first, second, 10th, 11th, and 12th rib, whereas for typical rib constitutes of third rib to ninth rib. You have to understand that the typical rib has same features. They have their same features. Their features does not vary. The features of the typical rib from third to ninth rib are the same, whereas the features of the typical rib varies. The features of the first rib is quite different from the features of the second rib. Likewise, the 10th, 11th, and 12th. That is how they are being what? Fashioned. The next is according to the relation to the sternum, right? Now, you have to understand that the ribs are classified according to relation to the sternum by the following, which is the true ribs, the first ribs, and the floating rib. So, we have true ribs. We also have false ribs and floating ribs, right? True ribs are those ribs that made a true articulation with the anterior end on the lateral borders of the sternum. That is how the true ribs are fashioned on the thoracic cage. They are the ribs that extend vertically from the first to the seventh rib. So we have rib first to seventh rib are the true ribs. Now, the false ribs are those ribs that articulation or that articulate with the higher cartilages. The higher cartilages are those cartilages of the true ribs. So they include from 8th rib to 10th rib. So these are the false rib. They do not form a true articulation with the lateral borders of the sternum. They only articulate with the costal cartilage, the higher cartilages of the true ribs, right? That is from first to seventh rib. Now, floating ribs are those ribs that the anterior end are pointed, right? The anterior end are free. They don't make any true articulation, either with the costal cartilage or even articulating with any ribs. They are just on their own. That is from rib 11 to 12. 11th to 12th rib. So these are the classification of ribs according to the relation to the sternum. The next classification is according to articulation. According to articulation, the number 3 is here. According to articulation, right? According to articulation, we have the vertebrosternal rib, vertebrosternal rib, we have vertebrochondral rib, we also have vertebral ribs. Now what? As the name implies, you should know what it means, right? Vertebrosternal ribs are those ribs which ranges from first to seventh rib, because recall that the ribs made an articulation with the thoracic vertebra through their posterior end, right? So every rib from first to 12th rib made an articulation with the thoracic vertebra. That is why all of them are bearing vertebra, right? Whereas the suffix on it, that is the sternum, chondra, and the vertebra, tells the different story. So vertebrosternal rib is the vertebra and the sternum. So there are those ribs that ranges from first to seventh rib, right? While vertebrochondral rib are the what? The false ribs, right? Which is 8th to 10th rib, right? Now, the vertebral rib are the floating ribs, which is 11th to 12th rib. So this is how they are being what? Fashioned. You have to understand again that the true ribs can be called the upper ribs. The true ribs can be called the upper ribs, right? The false ribs and the floating ribs can be called the lower ribs. That is how they are being fashioned also. So that is the classification of ribs, right? We have the classification according to features, according to relation to the sternum, and according to the what? The articulation. Now, we shall be going to the in-depth features of ribs. The in-depth features on how ribs are being discussed, their features and everything. So let's quickly look at the typical and atypical rib, because the typical and atypical rib tells all the features of the whole ribs, right? So let's begin with the typical rib. Look at this diagram here. This diagram here depicts the typical rib. Whereas every diagram here depicts the atypical rib, right? So this is the typical rib, right? The typical rib. The typical rib has a profound feature, right? Because the features of the typical rib are the same. Those rib that ranges from third to ninth, they are the same features, right? Whereas the features of the atypical rib, which is the first rib, the second rib, the 10th rib, and the 11th rib and 12th, their features are different. They are different from each other, right? Whereas for the typical rib, their features are the same, ranging from the third rib to the ninth rib. Let's quickly look at the features of the typical ribs. We have the typical rib has the following features. It has an anterior end. It has an anterior end. It also have a posterior end. This is the posterior end. All here is the posterior end. And it has a shaft. Here is the shaft, right? And this is the posterior end where it made articulation with the thoracic vertebra. Now, the anterior end of the typical rib forms a cup-shaped concave depression, which is it here. It forms a what? A cup-shaped concave depression within which it made an articulation with the costal cartilage to form a primary cartilaginous costochondral joint. That is for the anterior end of the typical rib. It forms a cup-shaped concave depression. Concave means a concave surface is a depressed surface, right? It is a shallow or hollowed surface. So look at it here. A cup-shaped concave depression within which it made an articulation with the costal cartilage, right, forming primary cartilaginous costochondral joint. That is for the anterior end. Now, the posterior end, right, forms or it constitutes the head, the neck, and the tubercle. Now watch. This is the head, right? This is the neck. And here is the tubercle. This is the tubercle, right? The tubercle is divided into two parts. The articular part, which is the medial articular part, and the lateral non-articular part. As we proceed, we discuss those features. So, this is the tubercle. Now, 5 centimeters away from the tubercle, 5 centimeters away from the tubercle, the rib abruptly changes what? Direction to form the angle of the rib. So here is the angle of the rib. So the shaft of the typical rib is flattened. The shaft of the typical rib is what? Is flattened, right? It is flattened and it contains or it constitutes the inner surface and the outer surface, the lower, which can be called the inferior border, and also the superior border or the upper border, right? It also have a coastal groove. As we proceed with the features, we will discuss everything together. So, this is the outer surface of the shaft. Outer surface. From here is the outer surface, right? While here is the inner surface. This is the what? Inner surface. Now, this is the upper border or the superior border. While this is the lower border. The lower border. So these are the features of the typical rib. Now let's discuss them one by one. Let's begin with the head. The head. The head. The head of the typical rib is divided into two articular facets. We have the upper smaller articular facet, upper articular facet, and lower larger articular facet. And there exists a crest of intra-articular ligament. Here is a crest. Crest of intra-articular ligament. Look at it. Intra-articular ligament. This is the crest separating the upper and lower articular facet. Now, the upper articular facet articulates with the next higher vertebra, right? It articulates with the next higher vertebra. That is for upper articular facet. Now, the lower articular facet articulates with the transverse process of the corresponding vertebra, or it articulates with the numerically corresponding vertebra. That is how it works. The lower articular facet articulates with the numerically corresponding vertebra. That is for lower articular what? Facet, right? Next one we shall be discussing is the neck. The neck constitutes the two surface and the two borders, right? It has an upper border and a lower border, and also posterior and anterior surface, right? You have to understand that the neck is an important feature of this what? Of this typical rib, right? It lies in front of the transverse process of the corresponding vertebra. That is for the neck. It lies in front of the transverse process of the corresponding vertebra, and it has two surfaces and two borders, right? The upper border and the lower border, and the posterior and anterior surface. The upper border usually form a crest appearance, like it has a sharp crest appearance, whereas the lower border or the inferior border is rounded, right? It is rounded. Now, the posterior surface is rough, which is being pierced by foramina, whereas the anterior surface is smooth. So those are the features of the neck of the typical rib, right? The tubercle. Let's discuss the tubercle. The tubercle is an important feature, right? It's an important feature of the typical rib. The tubercle is found on the outer surface. You can see it here. It is found on the upper aspect of the outer surface. Look at it. On the outer surface, right? And it constitutes two parts. The medial articular part and the lateral non-articular part, right? The medial articular part and the lateral what? Non-articular part. Now, the medial articular part articulates, or it forms an oval facet. Look at it here. It forms an oval facet which articulates with the transverse process of the corresponding vertebra. Whereas the lateral non-articular part does what? It is rough and provides sort of attachment of the ligament. That is what it does. This one is rough, which is the lateral non-articular part, whereas the medial articular part forms an oval facet which articulates with the transverse process of the corresponding vertebra. That is for the medial articular part. So this is the tubercle. Here is, for this, which is this, is the non-articular part. Why this is the articular part. This is the medial articular part. This is the what? The lateral articular part. You can see how they are being fashioned, right? You can see it over there. Now, we have discussed the head, the neck, and the tubercle, right? Let's quickly look at the shaft, right? We have said that the shaft is actually the longest portion, or the long portion of this rib, extending between the posterior end and the anterior end, right? You can see it is the longest portion, right? Extending between the posterior end and the anterior end, right? Now, the shaft is flattened. It has an inner surface, the outer surface, the upper border, and the lower border. It is curved with a convexity and is directed outward. You can see it is curved with a convexity that is directed what? Outward. And it has an inner surface, right? It is an inner surface which contains the costal groove. So this is the costal groove. This is the costal groove, which lodges the intercostal vessels, which are the intercostal vein, nerves, and artery, right? It also provides set of attachment of muscles, such as the intercostal, the internal intercostal muscle, and also the intercostalis intimis muscle. As we proceed, we will get to look at those features, right? So now, let's begin with the upper border or the superior border, right? The upper border or the superior border is usually thick and rounded. It is thick and rounded, right? It is usually thick and rounded, and it has an outer lip and the inner lip. It has an outer lip and the inner lip. Outer and inner lip. The outer lip provides set of attachment of the external intercostal muscle, whereas the inner lip provides a set of attachment of the internal intercostal muscle and also intercostalis intimus muscle, right? That is how they are being fashioned. Now, the lower border or the inferior border, is usually sharp, and it forms the lower border of the costal groove, although it provides set of attachment of the external intercostal muscle. That is for the lower border. Now, let's quickly look at the outer surface. The outer surface is smooth and convex. It is smooth and convex. It is arched or smooth. It is arched or convex, right? Because an arched surface is a convex surface, right? So it is smooth and convex or arched, which is divided into two angles, right? The anterior angle and the posterior angle. The posterior angle can be called the only angle because it forms the the oblique ridge. It forms the oblique ridge, whereas the posterior angle forms an indistinct oblique line. So this is the oblique line. The oblique line, right? This is the oblique line. Now, let's discuss the inner surface. The inner surface is a concave surface and it is smooth. It's a concave surface and it is smooth, right? It contains the costal groove, which continues near the lower border. You can see it here. This is the lower border, right? Continuous near the lower border. This is the costal groove. Inside here is the costal groove, right? So the costal groove lodges the intercostal nerve, intercostal vein, and intercostal artery, right? Although the floor of the costal groove provides site of attachment of the internal intercostal muscle, whereas the upper border of the costal groove also provides site of attachment of the intercostalis intimus muscle, right? So that is how they are being fashioned on this area. So these are the features of the typical rib. Everything concerning the typical rib has been discussed. So the next we shall be looking on to is the atypical rib, right? The atypical rib consists of the first, second, 10th, 11th, and 9th rib. So these are the atypical rib, right? These are the atypical rib. Atypical rib. And this is the first rib. Okay. The first rib. This is also atypical rib. This is the second rib. Second rib. This is 12th rib. Right? Now let's start with the first rib, right? So pay attention. The first rib is the most shortest, broadest, and the what? And the curved rib. It is the most shortest, broadest, and the curved rib. The shaft of the first rib is flattened from above downward, meaning that it has an upper and lower surface and also inner and outer border, right? The head is small and rounded. It is small and rounded. So this is the head. The head is small and rounded, and it bears a small singular circular articular facet which articulates to the side of the thoracic vertebra. So look at the small singular articular facet. Singular articular facet, right? Small singular articular facet which articulates on the side of the thoracic vertebra, the first thoracic vertebra. Now, the neck is rounded also and is also elongated. It is directed what? It is directed upward, backward, and forward. It is directed upward, backward, and laterally, please, not forward. It is directed upward, backward, and laterally. That is for the neck. This is the neck. Now, the anterior end is usually larger and thicker. This is the anterior end. It is usually larger and thicker, right? Here is the tubercle. The tubercle and the angle coincide together. This is the angle. This is the tubercle. So now we shall be looking on the upper surface, the lower surface, the inner border, and the what? And also the outer border. So here is the upper surface. All of them are the upper surface, right? Here is the upper surface. So this is the outer border. Here is the inner border. Inner border, outer border, upper surface. The lower surface or the inferior surface is not found on this side. That is why it continues with the coastal plural. That is the inner surface. So the outer surface is usually arched. It is arched. You can see the outer, the outer border, please, not surface. The outer border is arched, right? Or convex. It is arched or convex. And it provides the origin of the first digitation of serratus anterior muscle. It provides the first origin of the digitation of the serratus anterior muscle near the groove of the subclavian artery. So this is that muscle, serratus anterior muscle, the first digitation of serratus anterior muscle. Serratus anterior muscle. The inner border is concave, right? Or depressed. It is concave or depressed. And it is being formed by a tubercle called the scalene tubercle. It is being formed by the tubercle called the scalene tubercle, which become adjoining with the upper surface to form the site of attachment of the scalenus anterior muscle, right? So this is the scalene tubercle here. Here is the scalene tubercle. This is the scalene tubercle. This is the scalenus anterior muscle. Anterior muscle, right? Okay. Recall that we said that the lower surface or the inferior surface become continuous with the coastal plural, right? That is why it's not seen on this aspect. It is found below it. That is why it's called the inferior surface. Now, the superior surface or the upper surface is crossed obliquely by two shallow grooves known as the anterior and posterior groove, which is being separated by a slight ridge which becomes continuous with the scalene tubercle, right? Look at that slight ridge here, which separate it, forming the posterior groove the anterior groove, right? The posterior groove lodges the subclavian artery, while the anterior groove lodges the subclavian vein. The posterior groove also lodges the lower trunk of the brachial plexus, lower trunk of brachial plexus, lower trunk of brachial plexus. That, look at it here. Now, an area behind the posterior groove who lodges the subclavian artery up to the costal tubercle. Look at the costal tubercle here. Costal tubercle provide the site of attachment of the scalenus medius muscle. Look at it here. Scalenus medius muscle, right? Similarly, an area in front of the anterior groove near the anterior end of the rib, because this is the anterior end, provide site of attachment of the costoclavicular ligament and also the subclavius muscle. Look at it here. Look at the subclavius muscle here. And here is the costoclavicular ligament. Costoclavicular ligament, right? So this is how they are being what? Fashioned. So we have discussed the features of the first rib, right? Let's quickly look at the second rib. The second rib is quite lengthier than the first rib, right? It is quite lengthier than the first rib, and the shaft of the second rib is sharply and highly curved. You can see it, sharply and highly curved, right? Towards the middle aspect, right? There exist the, like towards the middle aspect, the outer border or the outer surface, I mean to say, the outer surface does what? The outer surface gives a rough impression or a prominent tubercle for the attachment of the serratus posterior muscle, right? The serratus posterior muscle. So look at it here, the prominent tubercle. This is the outer border. This is the inner border. This is serratus anterior, please, not serratus posterior, right? This prominent tubercle gives site of attachment of the serratus anterior, not serratus posterior. However, the upper aspect of the outer border and the adjoining part of the upper surface give site of attachment of the scalenus posterior and also serratus posterior superior. Serratus posterior superior. This is the scalenus posterior. Right? This is the tubercle. So we have done justice to second rib. The next rib we'll discuss is the 10th rib, right? The 10th rib. What are the features of the 10th rib? The 10th rib actually have a large articular facet on the head which articulates with the vertebra. So it has a large articular facet on the head which articulates with the vertebra, and it also said to be shorter than the typical rib, like the other atypical rib, I mean to say. So that is how it works, right? For the 10th rib. The 10th rib does not have much feature like that. It does not have much feature. Just that it has a large articular facet that is found on the head, which articulates with the vertebra posteriorly, right? The next is the 11th rib. This 11th rib have a large articular facet on its head, it also have a slight angle and a coastal groove. It doesn't have a slight angle and a coastal groove, right? For the 11th rib, right? So it is an important rib that distinguish other ribs because it is a floating rib. It is a floating rib, right? This 11th rib also has another feature. 11th rib, it has no tubercle. It also has no neck. It has no tubercle. It has no neck. And the anterior end is what is pointed and tipped with cartilage, right? That is how they are being fashioned, the features. So these are the 12th rib, right? This is the 12th rib. You can see that the 12th rib have similar features with the 11th rib, just that the 12th rib does not have any angle. It does not have any angle, and it does not have any coastal groove, right? And it is way shorter than the 11th rib. So these are the 12th rib. This is the internal intercostal muscle. This is diaphragm. This is lateral arcuate ligament. These are the features. What that attaches on it, please, not features. Here is the quadratus lumborum muscle. This is the costoclavicular ligament. Costoclavicular ligament. Look at it here. This is latissimus dorsi. Latissimus dorsi. External oblique muscle. Serratus posterior inferior. Serratus posterior inferior. This I is for inferior. Inferior, please. Right? This is lumbocostal ligament. Erector spinae. Levator scapulae. Levator scapulae. This is erector spinae. So these are the structure that attaches on the 12th rib. The next is the clinical relevance. Clinical relevance. Clinical relevance. Number one is cervical rib. Cervical rib is an abnormal rib that is being formed, an extra rib, right? That is cervical rib. So it's an abnormal rib that is being formed on the thoracic cage, and it is not good because it causes thoracic inlet syndrome, because those structures will be cushioned up, those subclavian vessels will be cushioned up, right? Which usually rest on the first rib. The number 2 is lumbar rib. Lumbar rib could be formed also, right? That is an extra rib. Number 3 is fracture. Fracture of the rib cage could occur as a result of the traumatic injury on the rib cage, maybe an accident or fall from a height or all that. So fracture of the rib cage could fracture the ribs, right? Resulting to a severe damage of the thoracic viscera. The next is flay chest. Flay chest. Flay chest could occur as a result of the fracture of the ribs, thereby causing difficulty in breathing because the lungs will be damaged, right? So these are some clinical conditions that is associated with the ribs, right? I believe we have done justice to the rib, ranging from introduction to the clinical relevance. Thank you so much for watching.